Good morning to the students of first year MBBS batch. I am Dr. Tapan Kumar Jana, Professor and Head of the Department of Anatomy, Murshidabad Medical College, West Bengal. Today, I like to share you some important matters on the procedures of first professional MBBS examination in the subject of anatomy under the West Bengal University of Health Science as per their guidelines. Mainly, I will discuss on the three important topics. One is the theory papers, number two, practical and oral examination part, and number three, which is most important, the criteria of passing the examination. Let us discuss one by one. Number one, theory paper. There are two theory papers, paper 1 and paper 2. Each paper bears 100 marks. That means 100 plus 100, total 200 marks for theory papers. The syllabus for paper 1 includes general anatomy, general embryology, histology, superior extremity, thorax, abdomen, applied anatomy, and ATCOM. ATCOM means AETCOM, which means attitude, ethics, and communication, which I will discuss in another video in future time. The syllabus for paper 2 includes general anatomy, genetics, special embryology, head neck, brain, neuroanatomy, inferior extremity, and applied anatomy. Next part is the oral and practical examination. Marks distribution for paper 1 and paper 2. For paper 1 and paper 2, distribution of marks are same. There will be 5 questions. Question number 1, long essay type of question or structured essay question. Each question will be at 15 marks. So 2 questions will be 2 into 15 is equal to 30 marks. Question number 2, short essay type of question. There are 3 questions on this type and each question bears 10 marks. So 3 into 10 is equal to 30 marks. Question number 3 will be on short notes. There will be 2 short notes, one for 5 marks, so 2 into 5 is 10 marks. But remember that of these 2 short notes, one will be from the ATCOM. That means in one paper there will be 5 marks ATCOM. Question number 4, that is the applied anatomy part. There will be 5 questions. Each question will be at 4 marks. So 4 into 5, 20 marks. And last question or number 5th question will be on MCQ, multiple choice question. There will be 10 questions. Each question will be at 1 mark. So 1 into 10 is 10 marks. So total of these 5 questions will be at 100 marks in total. And importantly, the pass marks of the paper 1 and the paper 2 will be as follows. One student must obtain 40% marks, at least 40% marks in any of these 2 papers. If he has to pass, then he must obtain 50% marks in aggregate, combining with both paper 1 and paper 2. Suppose one student gets 40 marks in one paper. He must obtain at least 60 marks in the second paper, so that in combining with paper 1 and paper 2, that is 40 plus 60, it will be 100 marks, that is in aggregate will be 50%. But if one student gets 30 marks instead and in another paper gets 80 marks, that means it will be 30 plus 180 is equal to 110. But in aggregate it will be 110 by 2 is equal to 55% marks. But the student will be failed because he got 30% marks in one paper, which should be at least 40%. Next part of the examination is practical and viva voce or oral examination. Total marks allotted is equal to 100. Out of 100, practical examination is 60 and oral or viva voce 40 marks. In the practical examination, as per NMC guidelines, we usually conduct it in the form of OSPE, which is called Objective Structured Practical Examination. In this examination procedure, there may be 10 to 15 stations on the basis of the number allotted and the topics given in each station. And there may be extra 1 or 2 stations for the rest station. And another part is the viva voce, where usually we conduct the examination by the different examiners on the osteology and different visceras. So total marks 100. So one student must obtain 50% marks out of 100 marks to pass the examination. The practical marks will be added to the oral marks. Not like that, the oral marks will be added to the theory marks which was in the previous procedure. But nowadays in the new curriculum, as per NMC, the practical marks will be added to the oral marks which should be 50% to pass. So here 50 and for theory 100 out of 200. Total 100 plus 50 is equal to 150 to pass both in the theory and practical examination and in the subject of anatomy. If one student gets more marks in theory papers, suppose he got 160, but in practical out of 100 got 30 marks. That means 30 plus 160 is equal to 190, where it should be 150 in aggregate. But the student will not pass because he failed in the practical and oral. That means every student should pass separately in theory and separately in oral and practical examination. In spite of the above discussion, if you feel any difficulty in understanding or if you have any query or doubt, you can write me in the comment box and definitely I will discuss it in the next time.